Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. I'm joined today, as always, by the marvelous Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
I'm marvelous first.
You're marvelous. Dr. Martin,
board-certified second.
How you doing?
Yeah, very good. Very good. Thank you.
Good. We have a really exciting episode today, and this one came about because I was thinking about episodes we haven't done in a while, and I also get a lot of questions about our first episode on supplementation around surgery. So I went back and listened to it, and it's an excellent episode. I highly recommend listening to it. It is linked in the description box below, along with all of our information, including our phone number. I got to throw that in there all the time because I haven't gotten any voicemails in a really long time. So leave me a voicemail, please.
Don't do it.
Yeah.
Keep this going.
Or send me a text. I'm real sad about it. So it's actually an awesome episode.
Which is so weird. We're getting more interactivity now than ever, but no one wants to call and leave a voicemail. Maybe I'll call and disguise my voice.
Good luck with that. It has caller ID, so call from someone else's phone.
Oh, that's a good point.
So it's an excellent episode. I didn't want to do just like a rehash of it. So this episode truly is a standalone. So the information that's covered in the first episode on supplementation is not really reviewed in depth in this episode. So I do highly recommend listening to that one. It doesn't matter what like order you listen to them in. This is a complete standalone as well. But I do talk a lot more about dietary influences around surgery. And this one, I'm really talking about nutritional supplementation around surgery.
Perfect.
To give it a little bit of a different spin. And I also have updated things. That episode was 4 years ago. And there are new things that just from learning and continuing.
Science keeps moving forward, Amy.
Well, just life does too. I mean, there's new things available. Some of the things that I'm recommending did not even exist when that podcast came out 4 years ago. Like, were not accessible. So
yeah, I think that most patients ask us about supplementation around surgery. This is a very common question. Besides, obviously, is it going to hurt? How long is my recovery going to be? When can I look normal? But supplementation, or what can I do around surgery to have the best outcome, is a common question we get.
Yeah. Also because we bring it up. So I think it's potentially something that more of our patients ask about because it is something that's included in our pre-op packet. It's something that we bring up. So it is, and we ask about a lot also. So that could be, what is it, the chicken or the egg? So do our patients ask about it a lot, or is it that we ask about it a lot?
I feel like people are very receptive to that conversation. I guess that's what I'm saying.
Yeah, absolutely. So without further ado, let's jump in and talk about supplementation. My first precursor PSA, this is what I call the special note about diet and supplementation.
We need to have this in small lettering in a very quick voice.
This actually is in huge lettering. Always clear any/all supplements with your surgeon.
Right.
Not this surgeon, your surgeon.
No. Unless you come in here and do surgery with me, give me money for that. We have no contractual agreement.
Correct.
But, I think it's really important because not all surgeons, and this includes surgeons that don't just do cosmetic surgery, maybe have the same thought process as we do on supplementation.
Yeah, and it's often that a patient will call me after having their intake call with the well-meaning nurse at the hospital who tells them to not take something that I specifically gave them to take. And I'm like, yep, do take this. Thank you. They hear, and that's just them covering, all their bases. They have no idea what people have any level of education about with the supplements they're taking. So they just say, stop taking everything. But I did mention this in our first episode about supplementation, that a patient of ours who was having surgery with us, but then ended up having a heart issue come up and needed to have a heart surgery before she could have her surgery with us. And I had asked her to bring me a list of supplements she was taking. Also knew she was having heart surgery in less than a week. I said, have you told your heart surgeon that you're taking these? And she said, oh yeah, I told the nurse. I'm like, no, you need to call them back and tell them exactly what you're taking and find out if it's okay for you to keep taking this, because I would tell you to stop. So always clear your supplements, regardless of the type of surgery you're having.
How did the heart surgery turn out?
Perfect. She's super healthy. Yeah, lives at low altitude now because that was part of the problem she was also having. So yes, her heart surgery was successful, and she did stop taking that supplement after she called them back. If in doubt, I just say cut it out. So if you don't know what it is, just don't take it. You should not try to out-supplement a bad or inadequate diet. So no amount of supplementation is going to be effective or helpful if you have...
I had this conversation with my 16-year-old son.
Hey, your 16-year-old son is pretty smart. He was the one who was asking about beef liver.
Yeah. So he really wants to eat well. He wants to get in shape. But then he'll eat his meals that he wants to eat. And I said, just because you have good intentions about doing the right thing, or, eating more healthy, or whatever you want to call it, it's not like a weighted system. Like a good meal does not outweigh a bad meal, or something that maybe is less than desirable from a nutritional standpoint. And the same thing is 100% true for supplements.
Correct. And more to the point, that if you have issues with digestion or other GI issues happening, You can be taking all the perfect supplements. You can take everything I recommend. And if you're not actually digesting or breaking them down or have the ability to absorb them in your large and small intestine, you're not getting the benefit of them. So getting all those things in check prior, if you have the time, granted, not everyone knows it. A lot of times in advance, you might just be thinking about supplementation. You already had surgery and now you need to kind of backtrack and try and make your recovery as good as possible. But either way, before you start spending money on supplements, you should at least make sure that you have a good idea that you have an adequate, digestion, your diet is good. Those things should be in line first. Above all else, this is the tenets of my everything, a whole food, nutrient dense, properly prepared whole food diet. So if those are really the places to start, but make sure, as much as there's great information contained in this episode that we're not your doctor, clear all this with your surgeon first, please.
Hopefully you're a board certified surgeon.
Yes. Oh, yeah. Well, yeah, especially if you're having something like a heart surgery.
Right.
Yes. Make sure your doctor is board certified in whatever surgery you're having done. All right. So let's talk about why supplements around the time of surgery matter, good and bad. There are benefits to supplementation, but there are also potential downsides. Dr. Martin, what are some of the major downsides of supplement that can happen with supplements around surgery?
Well, number one, we've talked about this before, but you don't really know where a lot of these supplements, you really don't know where they're sourced from. They're not always controlled by the FDA. Many of them come from China. I have no issues with China, but they're not as regulated. So you don't really.
In the United States, they're not regulated.
Yeah. So you don't really know what's in these substances. So there could be things in the supplements that could increase bleeding or bruising. That's the big thing for me, cause more bleeding around the time of surgery. So in at least in our case, we'll have all patients talk to Amy. Amy will research what they're on and make sure we stop anything and everything that could have potential problems with it.
Yeah. So the main downsides of taking the wrong supplements around surgery is that you can have an increase in bruising and swelling. There are supplements, especially a lot of herbal supplements, which I have a short list that I'll kind of share with everybody, that can decrease your body's ability to clot properly, changes the platelet structure a little bit so that your blood doesn't clot well or quickly enough.
The clotting cascade is super complicated.
It is. I'm trying to keep that simple.
If you want to really blow your mind, go look at the way we clot. And it's like this long process that carries on for days and days and days. So there's so many different areas there that supplements could mess up.
Yeah.
And, that's a huge problem. And it could really affect the outcome of the surgery itself and put you at risk. Yeah,
you could have severe risk. And also you could just feel worse. There are some of these supplements, I'll explain why you could feel worse during recovery if you're taking them, feel much worse. On the flip side, there are benefits, right? Everything is the yin yang.
Oh, yeah.
So
that's why Sarah put the positive negative if you're looking at the slide on YouTube.
Yes, the pluses and minuses.
One of my favorite Sarah slides, I have to say.
This is a good one.
It's been with us for a while.
So benefits of supplementation, the right supplementation, is you can minimize bruising and swelling. You can recover from the effects of anesthesia more quickly.
Right.
You'll feel better during recovery, and you might actually recover more quickly.
Right.
How's that for a good drug ad, right? We're not talking about prescription medication. It's just supplements.
Yeah. And, I think that's where supplements are problematic. So you're the expert on this, and this is actually a really interesting episode for me because I get to listen to you and learn. But in reality, the main issue with supplements we don't really people don't have a full grasp of what they're doing. Mm-hmm. You're taking a supplement because you saw a recommendation on Instagram, or maybe you saw someone, they're like, oh, you should take this. In some cases, the doctor will tell you to take it, but that's few and far between. So a lot of times these are out in this nebulous area that we don't really know why we're taking them. We don't know exactly what they do. And that may be okay for normal life. I'm actually kind of against that, but I'm just say that may be okay. But around the time of surgery, the whole calculus has changed big time. And that's where you need to be very focused and oriented toward recovery. Recovery from anesthesia effects. What was the episode we did where I talked about anesthesia effects on cognition?
Oh, it was one of the ones researcher into.
Mm-hmm. And it was that study from China, speaking of China again. And it was like 30 pages and written in medical jargon and scientific jargon. You couldn't even read it, remember?
Well, you thought you couldn't, and that was when I did the one on all the breast cancer research.
I still feel like mine was harder.
Mine was just like reading acronyms for 12 pages.
Mine was it was like reading a mortgage or a loan. Don't ever do it. So, but I do think anesthesia is very safe. It's really kind of a misnomer. People were worried about anesthesia. You're going to have some really unwanted event. It's pretty uncommon. You're more likely to get in a car crash than have a notable unwanted event from anesthesia. But the side effects of anesthesia that are not notable, maybe they're not life-threatening, are pretty numerous.
Well, I think people also, though, attribute a lot of after effects of surgery. They put it all on anesthesia.
Yeah, and it's pain meds too. Yeah,
pain meds and just recovery.
And sleep deprivation. Yes. Yeah, that's so true, Amy.
Yeah. I mean,
maybe we need to like change the dialogue on anesthesia because we're kind of harsh in their gig a little bit.
But that's why your mouse study was good because they didn't do surgery on those mice. They just put them under.
Well, they kind of tortured them.
Or was that the one with the hip? They were doing the hip.
I don't even want to get into what they did surgery to these mice.
Well, but my point being, like you would have to isolate out the surgical component from the anesthesia component to know really.
Totally.
So what was the cognitive effect of just having anesthesia without surgery? And what was the cognitive effect of having anesthesia and recovery?
Right. If you remember, I mean, I have to go back and look at that data. It was something really high. It was this, they were even talking about cognition issues with people over 60 who get general anesthesia was as high as 60% after surgery. Now, most of that is short-lived, but some people had long-term issues.
That was also about the hyperbaric study.
Yeah, that was all mixed in there. Yeah.
Yep.
So
that was very interesting.
Interesting.
Yeah. So supplements, as Dr. Martin said, there can be good and bad. And all the supplements I recommend, I'm going to tell you specifically why, what they do.
Yeah, are you getting those real recommendations? That's why people are watching. Okay,
there are actually, and
thankful.
All of these, I have the brands. I have the brand I recommend. All of that listed.
So do you ever like read articles and they have like a really salacious headline? They're like, so and so did this and that, and they never really show you the picture of what the headline says.
Yeah, this is not that.
Yes. So we're going to get real information here, so you can be ready for your surgery.
Yes.
But we're not your doctor.
So supplements to avoid in general are going to be things that, like we
fish
mentioned,
oil is my favorite.
Are blood thinning or anticoagulating, meaning they cause your blood not to clot.
And I love green tea. I'm drinking green tea right now.
Or that stress your liver or can prolong or alter the effects of anesthesia. And I think that that's something a lot of people don't think about. Let's talk about the blood thinning ones. Dr. Martin mentioned fish oil and green tea. Now, some of these you will see are on the list of things to avoid, but they're on my list of good supplements after surgery.
Garlic, ginkgo, ginseng, ginger. I love all those.
Yep.
And your favorite, my favorite, you made me eat it once.
Turmeric.
Or as they say in Kentucky, turmeric.
That's on the Stuff We're Into episode.
Yeah.
So those are all things that are going to cause your blood to not clot and or thin it out. And, most of these you would have to have in a pretty large quantity to have it make an effect. But things like ginkgo, ginseng, feverfew, these herbal supplements are not regulated.
It's hard to give up feverfew, Amy.
It actually is. People, if you get really bad headaches when you come off of it.
What is exactly?
It's an herb people take. Yeah. So these are common, and that's why I use. I mean, there's way more, but these are the ones that are the most common. People see garlic on there, like, oh my gosh, I can't have pasta sauce before surgery. Like, no, that's not it. But you shouldn't be doing like garlic shooters or taking supplemental garlic. So these are things I'm talking about. Supplemental. I mean, do you have to stop eating fish before surgery? No, but you do need to stop taking fish oil. These are concentrated. Again, like things like ginkgo and ginseng, even ginger. Turmeric, there might be in just such a high dose that you're getting in a supplement form, far more than you would consume. Now, if you're consuming a lot of turmeric, like I had the turmeric tea or the turmeric lemonade, like that's too much. You should definitely stop that. But little bits of garlic, a little bit of fish before surgery, that's totally fine. Green tea that's why green tea is good for us. It's really healthy for the heart. It reduces blood pressure. It does a lot of really good things for us, but it also can have a slight blood thinning effect. So before surgery, you got to switch to herbal tea. The liver stress and anesthesia altering effects are things like valerian root and St. John's wort.
Okay, these names. Can we just please talk about these names?
I did not name these
There's valerian
things.
Steel. I think that was in Game of Thrones.
Probably named after valerian root. The root came first.
All right.
Yeah, so these are things that people take, like valerian, St. John's wort, kava, are relaxation
I've had kava.
Yep, kava tea.
Yeah, I had kava tea in Fiji.
Yeah.
And it tasted like dirt.
Well, it's a root. Yeah, it does taste like dirt.
And I had to act like it didn't taste like dirt because it was like during a ceremony and I was trying to be very respectful. I'm like, this really does taste like they took dirt from the ground and put it in hot water.
That's what they did with the root.
And it made my mouth numb.
Yeah.
Just so you know.
Yeah, it does. It can cause like a numbing sensation over the whole body.
It did.
Yep.
It was really cool because it was part of their ceremony. So it was like wonderful.
Yeah, but these things can alter the effects of anesthesia. If you're taking anything that's a system depressant anyway, and then you're trying to, depress the system a little bit more with anesthesia, that's why these things need to be avoided. Echinacea is one that a lot of people might be taking before surgery, right? It's going to make my immune system strong. Well, it actually is going to be really challenging for your body, your liver, to process all that echinacea and the effects of anesthesia. So definitely stop your echinacea at least 2 weeks prior to surgery. And then weight loss supplements or stimulants. So things like pre-workout, anything that is targeted toward weight loss is something you definitely want to stop before surgery, because even if it's a non-stimulant weight loss supplement, they might have things like high doses of CLA, green tea, things that you do need to stop before surgery.
Not a supplement, but Ozempic and the other new weight loss medications that are basically diabetes medications are using for weight loss. You should. Amy and I did some research. It should be at least 10 days beforehand.
14 because it's 2 doses.
Yeah, yeah. So if you're listening to this and you're on one of those medications, please stop it if you're getting general anesthesia or a tube for breathing.
Yeah, and we're only talking about supplements in this episode, not prescription medications. There are a lot of prescription medications that you need to stop before surgery.
So even though that's a medication, it needs a prescription, but people can just go get a prescription and pay for it.
Yep. Or they can get it through Weight Watchers or compounding pharmacy.
Yeah.
This is the problem. This is the problem with people.
So is it really a
it is.
If you could just walk into anywhere that is willing to,
well,
I just
you can also buy steroids at the gym. It doesn't mean it doesn't mean it's okay to do that.
I'm just trying to work through that mentally.
So, yeah. So, like I said, this is not an inclusive list by any means. These are just some of the most common things that people take, and this does not include medications to avoid at all. Prescription medications are a completely different category. We are not covering that in this podcast. That's a really big, deep hole of its own. All right, let's take a quick break, and we'll be back.
We'll be back.
We're back. So this is where it gets into the nitty gritty. This is what you all came here for.
Yeah, this is what you've been waiting for.
Like specifics. We go deep. We are getting into the specifics. So there are also timestamps in this episode like there are in all of our episodes. So if you only want to hear about one supplement, just skip ahead. But I highly recommend listening to all of these because I do explain the why of each of these as well, like why they're beneficial specifically for recovery around surgery. Okay.
Let's just see if you recommended all these when I had surgery.
Well, you didn't ask.
That's good. That's a good point.
Yes. You did not come to me and say.
Because I don't feel like you recommended too much.
Yeah.
I'm starting to feel a little bit mismanaged here.
You wouldn't even if I had recommended something for your finger, would you have actually, you put Trameal on it once.
One time.
Yeah. And tried, and that was it. So, yeah.
It felt better. Actually, the Trameal gel, I smashed my finger lifting weights. And the Trameal gel made a huge difference.
Using it once.
One time.
Imagine if you'd been using it like 3-4 times a day.
Well, it felt better. Then I was better.
Right, exactly. Oh, wait, that cured it. So there you go.
3 weeks later, it still hurts, but that's okay.
So the first supplement I recommend is Zinc. And the specific brand and type I recommend is from Designs for Health. It's called Zinc Supreme. I don't know why they called it that, but it's a combination. You'll see that if you look at the ingredient list on some of these, especially from the same company, there is some crossover, right? And that's why you need to be careful combining supplements because you can end up overdoing it on some, but the amounts in all of these, I'm fine with people taking all together. So zinc is a pretty amazing, it's a mineral. This is not a vitamin supplement. This is a mineral. And as we talked about before, minerals are what, Dr. Martin? Do you remember what I say all the time?
They're from the earth.
They are a series of cofactors, right? Minerals need other minerals to do their job, or they're signaling. So a lot of times you need these minerals in your diet because they tell other things in your body what to do. Specifically with zinc, it's extremely beneficial for all 4 stages of wound healing. We have a great episode on scars.
Excellent episode.
We talk about the 4 stages of wound healing. So zinc is what is critical to transport neutrophils and macrophages, which are kind of these
essential in wound healing.
They build, they digest stuff. Macrophages go and break stuff down. The neutrophils are bringing stuff in.
Release cytokines that brings more things in. I mean, it's like the whole process is dependent on neutrophils and macrophages.
It's like a miracle. And they signal what type of immune cells should be produced to aid in healing. So that's really important, right? That's how things heal. So if your body isn't able to make these, like the messenger isn't there, you might get the wrong stuff. And what that's going to do, slow down your healing or not optimize your healing. So it's also really helpful for the immune system function in general because it does all this signaling for it. It's required for collagen production, which collagen, go back to our scar episode.
Yep.
Need it to heal.
People don't realize that zinc deficiencies can lead to problems with collagen. It's not a common correlation. But I mean, if you're talking about wound healing, so if you're talking about something that relates to neutrophils, macrophages, and collagen, that's pretty much all of wound healing, pretty much.
Yeah.
So, I mean, it's integral in every step that occurs, even the remodeling part.
Yeah, all
associated
four
with collagen.
stages.
Yeah.
And it does. It basically is what gets the proteins, the correct types of protein collagen matrix happening, and is really critical I could have gotten so deep in this, basically the weaving of those collagen fibers as it heals.
Why didn't we make this the episode?
But that's just it. This could have been the whole episode.
I know, no one's going to like that. Right. They just want the answer. Zinc. Okay.
Also reduces
Don't let Dr. Martin
infections.
talk and ask stupid questions. Keep going.
Reduces post-operative infections. So in all of these supplements as well, like these are well-researched things. So you can actually find massive amounts of research that's been shown people who are zinc deficient have a far increased rate of post-operative infections, non-healing wounds. Like if you are zinc deficient, your body cannot heal as efficiently. Mm-hmm. So Designs for Health, Zinc Supreme, highly, highly recommend.
Yeah.
All right. This is a big category.
Right. Again, you didn't recommend this one either. You didn't recommend zinc.
The B vitamins.
Didn't recommend B vitamins either.
Didn't ask. B vitamins are a huge category, right? B vitamins are all water-soluble vitamins. There are many types. And it's so interesting when you look at vitamins as a group. When all of this was being kind of found out, right, by science, I think they didn't realize how much was going on. It's like, oh, B vitamins. I think people think like, oh, there's just a couple and they all do the same thing, but it's not true. So there's actually 2 types of B vitamins that I recommend. One of them is the Designs for Health B Supreme. I think I just like the Supreme part of it.
I kind of like it too.
I should have called you my Supreme co-host.
Yeah.
Next episode, you're going to be Supreme.
Yeah.
And then also the Gero B12. So specifically the B12. B12 should be used as like an oral or as a chewable. And that's why I like the Gero. They're these little, you just chew them up.
They have B12 shots, right?
They do. And people do this for energy, and we'll talk about why.
Right. And that's like if you go to those IV places, they'll do B12 shots too at the same time.
They'll do B complex IVs, and we'll explain why why B vitamins are so good. The Designs for Health B Supreme is a combination of it's a B complex, so it has all of the other B vitamins in it. It also has some B12, but because B12 is so critical for energy production in the cell, in the mitochondria, it gets broken down really quickly. And it's also water soluble, so you're going to excrete it really quickly. So it's something that I do recommend in addition to what's in the complex, taking the B12 also. B12 helps with energy production. Energy production is the mitochondria.
Favorite
the
organelle.
Yeah, cue the cell picture. Yes. So Dr. Martin drew this great
Nils
picture.
off the hook this episode.
It's the kidney bean looking thing. Dr. Martin also talks a lot about why mitochondria matters in our episode.
Love it.
February 1st, we talk about our best year ever challenge. Mitochondria is key for energy production in the cells.
It's key for everything and longevity. Mm-hmm. I'm thinking about my mitochondria right now. It's like how healthy they are, how active they are. They're not losing their energy production abilities, Amy.
That's right. So people do get B12 shots. It'll give you a little boost in energy. As I mentioned, though, B12 is a water-soluble vitamin, so it's going to be depleted really quickly, and that's why people then are going back for a shot the next week because they want that boost again.
But why is B complex better, or what is the benefit of B complex over B12?
Well, let me finish B12.
Oh,
so
sorry.
B12 also increases hemoglobin and
enhances blood flow.
Blood flow.
Yeah, exactly.
Why is that? Because the cells have more energy.
Yep.
So it's going to be really good for healing and recovery. It's getting more blood to those areas that need to heal, making your blood cells just kind of better and healthier because they're peppy. B complex, you could break down all the different Bs, but I'm just going to call it B complex altogether. Does a lot of things, and these are all the different types of B vitamins. It protects against postoperative stress on the body, so that it really helps when you're in times of high stress. Now, whether you feel stressed or not after surgery, your body is still stressed. Like it is stressful for your body to need to recover from samurai sword or a tummy tuck incision.
It's physiologically stressed.
Yes, it is stressful. It also improves immunity, brain function, helps with balancing cholesterol levels, which do go up after the propofol is used. And I think I talked about this later. The propofol can increase your transient cholesterol levels. So it helps with that. It also helps with digestion, which is key for recovering from surgery. Improves the absorption of iron, which again, goes back to our enhanced blood flow, better blood flow areas, healthier blood cells, really key, making your blood vessels, healthy again. Manages the biotransformation of drugs used during surgery and anesthesia. So what does that mean? That's a big word, biotransformation of drugs.
Like the it's bioavailable form, and that's what they talk about.
Right, and to get it out.
So you have the non-bioavailable forms, right, and the bioavailable form, or the active form, and that's probably the better way to put it in terms of the drug itself.
But then there's all these byproducts.
Like that, so.
No, but specifically with anesthesia, there are byproducts that kind of get in your system, so it helps kind of clear those out of your system after surgery. Specifically reduces fluid retention of the face, hands, and feet. and also aids in reducing surgical site inflammation. So you can have swelling, as we've talked about in many of our episodes, after surgery, but you can also have swelling or fluid retention from surgery. And that's a lot of the reason why we get people asking why they gain weight after surgery.
We should go in that Facebook group for Swell Health and the tummy tucks and tell them they need B complex.
Well, they do. But like even if a person who has like a facelift, right? They'll be like, oh my gosh, I weighed myself this morning and I'm up 4 pounds, and why is that? Like, well, you're retaining fluid. So it helps with fluid retention all over the body, but also specifically aids in reducing inflammation at the site of surgery. And another big one for recovering from surgery, provides immune protection and helps maintain proper blood sugar levels, which is also very key after surgery.
Yep.
You see that with people who've had long surgeries. They'll have blood sugar dysregulation issues when they wake up because you've been fasted for a long time. So B complex is going to help again with the energy in the cells, keeps those blood sugar levels more healthy, all that good stuff. So that's why complex is needed in addition to B12 itself.
Nice.
Yeah.
So, but it just seems, does B complex have B12 in it?
It does. And that's why I did mention that it does have some, but not
so why
really
would you
enough.
take? Oh, okay.
I covered that.
Did you say that?
I did.
All right.
I've said that at the beginning.
So Gero, listen, we're giving some real information. Gero B12, that's what we need to get. And B Supreme, Health B Supreme, which this company has a really good marketing person naming these supplements
Zinc
accordingly.
Supreme, B Supreme. Yeah, Designs for Health is a great company. One of the other things I really appreciate about them as a company is that they do package everything in dark glass bottles, so you can, the bioavailability of what's in there and just like the concentration, you have a pretty good, that's why, the brands I recommend have a very good track record of actually putting in them what it says on the label.
Right.
So, which is key with supplements in general. All right. Liposomal curcumin. This did not exist when we did our previous podcast about supplementation around surgery. Specifically, the one I like because it's easily accessible is from...
you love curcumin.
I do.
It's just like in your top three, turmeric and curcumin.
Well, it's the same thing, actually.
I know.
Yeah. Amy Myers, not me, unfortunately. I don't have my own supplement line. Do you think there's
like some curcumin, like... what do you call when you go to Washington, lobbyists, some curcumin lobbyist that's gotten into your DMs? Maybe sending you a little bit of money.
I wish. Please do. Curcumin lobby, hit me up. I'm your biggest fan.
Yeah.
So Amy Myers makes a great one that is easily accessible. Her products can be found everywhere, and it's called liposomal curcumin. So Amy Myers, liposomal curcumin. It is a liquid, thus the liposomal. So liposomal products, you'll see this come up again when we talk about vitamin C, are in a very bioavailable format. That is one of the issues with things like taking curcumin and turmeric is that they're not very bioavailable in the body, especially in a supplement form, because by the time they're actually into the large and small intestine, they're not really getting the job done essentially. So they're not as powerful. So specifically after surgery, I like this liposomal form because it's readily available, doesn't have to be digested, gets absorbed really rapidly, and actually can help modulate inflammatory response. It's also a powerful free radical fighter. It will stain everything it touches. It's very yellow. So don't get it near anything, including a white countertop. It will stain everything. But because of that it just shows you how intense those active ingredients are.
If a little bit spilled out your mouth, on your chin, would it stain that yellow too?
It would. You could wash it off, but it would look like you were, I don't know.
You got to be careful with this stuff.
Also supports immune function, really supports your detox pathway activity, essentially. So clearing the liver, and it helps with gut health. Also, they've done great studies on curcumin after surgery, and it does help with pain. We're specifically in spine surgeries. So it does have a component that can help with pain. Now, why would that be? Well, because it's decreasing inflammation.
Right.
So, and it's fighting free radicals, which is kind of helping everything heal quicker and better. So there's reasons for that, right? There is a cause and effect there. It helps with pain because it's helping with your inflammation. It's a great supplement. Highly, highly recommend. I do recommend using the bottle until it's gone and then switching for a longer duration use just to a regular curcumin tablet supplement is fine as long as it does not have biopurine in it, which is a black pepper extract, which they say increases the bioavailability of it. However, it's really can be harmful to the gut. So I don't recommend anything with that in it. I didn't put that supplement, the kind of long-term use curcumin in here, but you can continue to take curcumin after this initial liposomal curcumin is gone.
It's just another thing you didn't recommend. That's okay for me.
That's correct. CoQ10. CoQ10 is something.
This one you did recommend.
A lot of people take it also for heart health.
Yeah.
It's the one I recommend is really the one from Gero. If you really want to spring for a very pricey supplement, you can get CoQ10 with PQQ. very pricey, so CoQ10 alone is adequate, or from Integrative Therapeutics. Both of those are very quality brands that do have the percentage in them that they say. This is also necessary for the production of cellular energy, especially ATP in the heart, liver, or where the highest concentrations are in the body. So you think about it, when I talked about like feeling better after surgery, if your heart and liver are needing to work harder, right, to get blood to where it needs to go, your liver's detoxing all these things, you're going to deplete your availability of CoQ10 rather quickly.
Yeah. And then you're depleting ATP, right? Because you're using more of it. So you need to create more energy. And CoQ10 is a big part of that ATP energy process. So.
Yeah. Yeah. So super beneficial to supplement.
And so is the mitochondria.
Yep. Well, that's where the ATP, it's where the magic happens. It's also a powerful antioxidant, which again, after surgery, you have you can have some free radical damage. Maybe you've had x-rays and other things happen before your surgery. So there's a lot going on in your body that needs to be kind of mitigated and managed. And antioxidants are also, if you kind of think of them as like a partner. So if you have something that your body is fighting, like your little free radical is here, an antioxidant comes along. Here's the magic school bus.
I wish you guys could watch this if you're listening to this on a podcast.
Attaches to it and takes care of it, but then it's gone. So there is no more free there's all these other free radicals out there. So you need a continual supply of these antioxidants.
Yeah, because I mean, not that I'm an expert in this, but that kind of binding of the free radical is usually permanent.
Yep.
Which is how it doesn't get re-released. It doesn't usually just change it and send it on its way.
Yep.
Yeah.
So it basically uses both up, right? So it's autophagy happens and they both die. So you definitely need those antioxidants, especially in times of stress. We're going to call surgery stress. So upping your supply of all these things is really, really beneficial. It's going to help you feel a lot better too. So CoQ10, most surgeons will start taking this prior to surgery. I definitely recommend it after. The last one I should have mentioned with curcumin absolutely needs to be stopped before surgery. You saw that on the list. Turmeric is the same thing. So definitely do not take that before surgery. That's to start after surgery only. The B vitamins and the zinc you can also start before, in my opinion. Again,
ask your surgeon.
Yes, ask your surgeon. Like the things right? What's the after school special? The more you know with the little rainbow. Yep, ask your surgeon. All right. Here it is again. Liposomal vitamin C. We
knew this was coming. We knew vitamin C was coming.
Yes.
If you would have asked me, I would have said curcumin or turmeric, and I would have said vitamin C.
Yep. And we talk a lot about vitamin C in our first episode.
I forgot about CoQ10. Zinc, I always forget about zinc. I don't know why, but zinc is so important for wound healing. Yeah. Extremely important. Sorry, go ahead.
So liposomal vitamin C is also something that was not readily available at all when we did our first episode on supplementation.
Can I ask you a question real quick on this? Yeah, I'm sorry. So vitamin C is supplemented in a lot of our foods. So Americans, are they usually deficient in vitamin C? So why would a supplement even be needed? I could see zinc. I could see CoQ10.
Mm-hmm. So vitamin C.
I could see vitamin B also, because sometimes where do you get vitamin B from? Like meats? Like
foods,
red meats?
Seafood, nuts.
Yeah.
Yeah. And we talk a lot about where you can get these things nutritionally. In our first episode on supplementation, we talk a lot about the food sources with these, which I'll kind of bring up at the end as well. But vitamin C, as we talk about in that episode, is a water-soluble vitamin. Your body processes it very quickly. So basically it uses what it needs in the moment, and then
it's not stored.
It's not. It's not stored at all. We talk about the ADEK vitamins in our first episode, which are more storage.
ADEK, which are fat soluble. But
these water-soluble ones, like all your B vitamins, that's why the B vitamin shots are kind of pointless, because yes, you can.
I was about to get to that. So these people going for the shots, I mean, it's only transient, right?
Correct.
So you would have to get either maybe infusions on a weekly basis.
Well, that's
Is that
why they
the
go
idea?
back and get the shots every week.
Oh,
yes,
okay.
And you can also get vitamin C, like in your recovery IVs. Like the people who are doing boutique, they always put vitamin C in there. But it's all getting flushed out. So what you don't use in the moment is just gone. So after surgery, specifically with this liposomal vitamin C, I would recommend taking it twice a day.
Again, if we had a bigger budget, we could do Eminem's One Shot song in the background while you're saying this. You have one shot.
I would be playing a song by Vitamin C.
Oh, yeah. I mean, vitamin C.
Yeah.
Which is showing your age.
All night about the rest of our lives.
Oh, yeah.
Yeah. I would play a vitamin C song. The specific,
probably about 3 people who are watching this remember
the graduation song. Yeah. Oh, come on now.
Yeah. That's so your era. That's like early 2000s. Yeah.
We will still be friends forever. Yeah. Everybody just clicked off.
Yeah.
The one I recommend, this is a hard thing to find. as is the liposomal curcumin, because it is really more of a boutique kind of supplement, is from Quicksilver Scientific. It is their liposomal vitamin C. Again, I would recommend taking it twice a day. It's liposomal, so it's kind of an unusual supplement to take because it's really oily, or like has that thick heaviness of a liposomal product, but it also is vitamin C-ish, citrusy, interesting. So it's very, very beneficial. So vitamin C is essential for production of collagen, blood vessels, cartilage, ligaments, tendon, and what else, Dr. Barton?
The skin.
Skin, which is the thing that we've talked about that everybody asks about. Like, oh, am I going to have a scar? I'm like, what about your blood vessels? Oh my gosh. And we're destroying all this stuff on the inside. All people ask about is their skin. So vitamin C is absolutely essential for recovery. And that's why people put vitamin C on their skin. Like I do. I use a vitamin C serum at night. Like vitamin C is very powerful for helping with our skin.
Yeah. So, but you didn't answer my question. Do we truly have a deficiency, and is it necessary?
The deficiency question. Is it necessary? Yes. And I think we talk so much about this in our first episode with basically the bioavailability and the breakdown of vitamin C. So
normally when we're like in our lives eating a healthy, nutritionally balanced like diet, you have enough vitamin C for daily functioning. Is that correct?
Correct.
Okay.
To prevent scurvy. Yes.
Okay. But when you get injured, you go through a lot of your vitamin C because by nature, you have to do a lot of production of collagen, blood vessels, cartilage, ligaments, and skin, or healing of the skin. And that will use up your minimal to no stores of vitamin C. And from a dietary standpoint, you may not be able to keep up with it. Is that correct?
That is correct. And it's also, this is why I recommend a liposomal vitamin C, because you're not having to make your body work to get it.
Got it.
So when you are in acute recovery, meaning the first like 7 to 10 days after surgery, your body's working really hard to do a lot of other things. And yes, you probably have enough vitamin C floating around your body to do the basics of some of these tasks. However, under stress, which is recovery, it's going to get depleted really quickly and not replenished quickly enough. And your body's then going to have to work even harder to try and get more from wherever it's getting it from, breaking it down from food. Whereas if you're getting a liposomal vitamin C twice a day, that is instantly going to where it needs to go.
Yeah. And this is where you get into the postoperative recovery, anesthesia. People have nausea. They're on opioids. Opioids slow your gut down. They don't want to eat things that are acidic that would have vitamin C in it. Maybe it doesn't make your stomach feel good. I mean, it can be problematic. So that's where supplements can be really helpful. It's a concentrated form of what you need.
Which is part of the good bad of supplements, remember from the beginning.
So let me ask you another question then. So do you think you need vitamin C long-term supplementation?
For normal, healthy people, no.
Okay.
I don't think that you need to be taking supplemental vitamin C. I do recommend using vitamin C around the time of surgery.
Yeah,
absolutely.
I totally agree.
Or if you're sick or have had an injury.
What about long-term vitamin B complex supplementation?
Same. Nope. And I am not a pill for an ill person. I also do not recommend, as anyone
who's trying to pull that out.
Anyone who's worked with me as a nutritional therapy client knows that I recommend supplementation as a needed basis, not as a lifetime basis. I'm more of a pill for an ill person.
I'll come in, I read this article, I think I should take this. And you're like, no, you don't need to.
Yeah. And there are,
Eat some Brazil nuts. Not Brazilian nuts, Brazil nuts.
Just 2.
Yeah.
Because 3 is weird, as we established
3 is weird.
on previous podcasts.
But it's probably conceivable. 3. Yeah.
So with that's why on the very first slide, above all else, whole food, properly prepared nutrient-dense diet, for most people is adequate for daily living.
Right.
These are things that I recommend supplementing with specifically around surgery for these specific reasons, not for lifestyle factors. Now, vitamin C, using it topically as a topical antioxidant,
which I do,
is great. Daily use.
Yep. Love it.
Yeah.
And there are supplements that are necessary for daily consumption, but
for some people,
For some people, like for example, I take fish oil, right? Because
brain health,
my age and my brain. So I think fish oil is one of those that I think universally people would agree has a benefit to people of certain ages. So, but I think that's the problem when you get into supplementation ultimately, and not to, you've taught me this, is that it has to be very goal oriented.
You need to know why you're taking it.
Right. And what happens is, even with someone like me who has a higher knowledge base, is you kind of slowly find yourself taking more and more supplements. And you need to really evaluate why are you taking the supplement, what is your goal, what is the recommended outcome, and most importantly, can I get that from a nutritional diet instead? Vitamin C is one of those things that's difficult. You've talked about it before in terms of storage. That's why if you look at all the vitamin C kind of even cosmetic products are always in those kind of darker kind of glass, right?
It should not be in a clear container.
Yeah, opaque.
Yep.
Is that the right word?
Yep.
Yeah. So, and so it's can be a little bit harder to store, et cetera, et cetera. And that's where the liposomal component comes in, which is so interesting because of the liposomal marking that we use now.
Yep.
You know, because it has an ability.
Acts faster.
Yeah.
And stays where you put it.
It stays where you put it, but it actually works surprisingly slower because it stabilizes the marking. It doesn't immediately get released. So interesting.
So, and that's why I like Quicksilver Scientific. It comes in a dark glass bottle and it does require refrigeration after opening, which it should, because it's going to start to break down as soon as it's exposed to oxygen. Remember, free radical, oxygen, molecule, what comes and attaches to it, and then they both disappear. So every time vitamin C, whatever it is, a topical, an oral, whatever, is exposed to air, it's breaking down. So that's why it's really specific how you store and why I pick these certain types of products for their, unique purpose. Something else about vitamin C is it's going to increase the bioavailability of iron, which you need for recovery. It helps recycle vitamin E. So it gets, did I spell that correctly? Yes, I did. It just looked weird for a second, like recycles is spelled correctly. And helps elevate glutathione levels. And we'll talk more about glutathione in a moment. So it's doing a lot, and that's why supplementing is important, because it's doing so much that you're going to need it more. And it would be very hard / near impossible to get optimized levels after surgery through diet.
Right.
You would be eating a lot of citrus and then have some gut issues.
I like citrus.
Yeah.
I could eat a grapefruit every meal.
Could you eat like 12 a day? Right?
That's the problem, is the bioavailability of, you'd have to eat a lot.
And could you do that for a week? Yeah. Yes.
I love fruit. I love salads and I love fruit.
Yeah. So liposomal
Is that bad,
vitamin
Amy?
C.
Is that okay to like salads?
They're both
and fruit?
awesome. Love both of those things. Yes. All right. So let's talk about glutathione. This is another one that would.
I know this one too. I should have guessed this before.
Yep. And glutathione I have recommended for you.
Yes, you have.
Yep.
What was that for? I can't remember. It was something specific. But anyways, keep going.
So glutathione, the one I recommend is from Apex Energetics. This is a physician only or a medical care provider only supplement. You cannot buy it over the counter. If you find it over the counter, I would not buy it unless you're buying it from a medical professional, because it's probably not real product and it needs to be refrigerated. So it is a transdermal glutathione. It is a liquid, again, that is stored in a dark glass container in the refrigerator. And it tastes, I don't mind the taste. Some people think it's gross. I actually don't think it tastes bad.
It's a little bit fruity.
There are other glutathiones on the market that are disgusting.
Yeah, no, it's not that great. And it was funny because when I first had it, that was like when we first started carrying more supplements. My wife was like, what is this strange concoction? She thought it was something like home brewed. I'm like, well, there's a professional label on there. You think like the guy down the street is printing his own labels? It has that. It was a dark glass kind of container.
Glass. Yeah. And it's pretty big. It's a really awesome supplement. It's expensive. It is trisomal, meaning it is a water and fat-based supplement, which is really cool because you get some rapid release of this glutathione, but then also some longer term kind of in the body. It is the master detoxifier of the body. It is such a powerful antioxidant. The key thing, and this is why I got it for Dr. Martin, is because it supports brain function.
That's right.
And it's really important for the immune system function.
Gotta keep this going.
Yeah. Also modulates liver and detox activity, again, because it is such a powerful detoxifier. Glutathione is a really remarkable supplement. It is pricey, but it's one that I would put kind of high on the list for someone who really wants to optimize their recovery, mostly in feeling a lot better after surgery mentally.
So it seems like glutathione kind of gets in that one that you could do before surgery.
Yep. For us, but it's a trisomal, so maybe not.
I understand. But glutathione may have a benefit to your entire life.
Yes, absolutely. And there are anti-aging people who recommend this to, as probably the top supplement to continue taking. It would get very pricey if you're getting a high quality one. You can find glutathione in a tablet. I would not recommend that. You're not going to get the benefit of that. It's not bioavailable in that form. Probably a little bit better than it used to be in tablet form, but I would still, this is the only one I would recommend. The Quicksilver actually has a glutathione. It's not easy to palate. It is very challenging to consume. And I take fish oil. So
yeah, you take cod liver oil.
Right, I've made you guys drink cod liver oil.
And the one you gave us tasted like fish oil with Fruit Loops.
Yeah, and I said, at least you had the Fruit Loops.
So if you find that okay, then this glutathione from Quicksilver must be disgusting.
It's not very tasty.
Or it must be great if they want to sponsor us.
I mean, it's probably just I'm so used to the one from Apex. I mean, Apex is a brand I've actually used since I very first became a nutritional therapy practitioner.
Apex
I mean,
is the OG.
It is an amazing brand. So highly recommend it. Glutathione is very helpful after surgery, really great for detoxifying, but also really going to help your brain function at its optimum, which, as you remember from the episode about Dr. Martin recovering from surgery being in the upside down world, like it does something with your head, just like it does with the mice. So it really will help you get back fast. All right, let's talk about the one homeopathic that I did not mention in our previous podcast about supplementation, which is homeopathic phosphorus. Byron is the company I recommend. You guys have all seen it. They're the little tubes, the little blue or purple tubes that you twist back and forth, get the little thing to drop out, and you toss those pellets in your mouth. Phosphorus is excellent for decreasing.
What is she talking about?
I
have never seen this.
I have sent Byron supplements home with you. Remember when Jake had the warts and you wanted to freeze them off? And I said, just take this, and they went away. It wasn't phosphorus. It was a different supplement, but it's in that little tube. So this is really helpful for decreasing the symptoms of anesthesia. So specifically been studied with postoperative nausea and vomiting, what we call PONV, dizziness and sleeplessness. So it's a weird combination that people can have after surgery. They're dizzy, they're tired, but they can't sleep.
Their REM sleep is messed up. That's a big part of it. So if you mess up, man, if your REM sleep is decreased, you feel it in the morning. It's a big part of sleep issues, I think, for people, disordered sleeping. You see that also in Parkinson's, where people have REM disorder sleeping. So I mean, definitely after anesthesia, people feel tired even though they sleep even probably the normal amount of time.
Yeah, and you might not be sleeping well because your surgery, you're in pain, you can't get comfortable, you're having to sleep on your back when you're not used to it. There's a variety of reasons, but this is really helpful just for those first few days after. This is not something you need to take before surgery. This is really helpful for the immediately postoperative period. So like the first 4 to 5 days. Not something I recommend taking long term unless you're having dizziness or nausea that's unrelated to surgery perhaps, but this is really great for just that acute period right around surgery. And it's like $8. It's a really inexpensive supplement. It's homeopathic. It does not interact with any of the other supplements I've recommended. So a great one to add in. If you want to hear about the other homeopathics, I recommend that we talk about those in our first episode, things like arnica and some other really cool combo kind of things for surgery. So those are my current supplement recommendations around surgery.
Can we go through the list one more time?
Yes.
Okay. So Zinc from Supreme.
Designs for Health, Zinc Supreme.
Zinc Supreme, which is my favorite just because of the name. We talked about vitamin B, so both for B12 and B complex, right?
Correct. B12 should be a chewable or a liquid that comes from Jarrow. And then the B complex I like is from Designs for Health. It is the B.
Right. Vitamin C we talked about.
The B what?
What?
B Supreme.
Oh, B Supreme, excuse me. Yeah. Vitamin C.
Liposomal vitamin C specifically.
The phosphorus, which I still don't think I've seen it.
Oh, that's not the one I sent home with you, but they're all in the same little
but it's like
tubes.
something you turn and it's like it's purple and blue, like you're at a rave or something.
It's like the size of a chapstick tube.
Okay.
And the same size, and like you literally just
Are they pills?
They're little pellets, is what they're called. They're teeny
Oh, you
tiny
turn the tube.
Yeah, you turn it back and forth.
I thought it was something that glowed. I don't know. I was getting some Matrix thing.
Does not glow.
All right.
If it's glowing, maybe call your doctor.
Yeah. And I'm missing one.
Liposomal curcumin.
Yeah, curcumin, of course.
And glutathione.
Glutathione I've taken from Apex. Amy got it for me. It is expensive, but it's a really good supplement. And it tastes okay.
I think it tastes, the one from Apex I think actually tastes really good.
It was totally fine. Yeah. It has a little bit of a kind of a
little citrusy,
tangy.
They actually add that flavor in.
Do they really?
Yeah, which is I think the Apex or the one from Quicksilver is
straight glutathione.
It is hard to take. But glutathione is great anytime you're under stress. So for any reason.
All right, quickly, 2 questions. So number one, do you change these supplements depending on the surgery people are doing?
I would not. These are broad recommendations. They're good for any surgery.
Okay, that's what I wanted to know. So like if someone has a tummy tuck versus something short incision like a brow lift, you would just still. Yep.
Yeah. I mean, or a knee surgery, knee replacement, hip surgery, heart surgery. Yeah.
And is there some hard reasons to not use some of these supplements? I mean, when you're really going through when they're talking to their doctor or their care team, is there a reason that they wouldn't use some of these supplements? Can you think off the top of your head?
Yes. I mean, I would say that most of these supplements are very safe to take. They are also from extremely reputable companies, so you're getting what you are supposed to be getting. I would say the ones that there may be some surgeons that don't want you to take maybe any liposomal products for like a week after surgery because it may increase your risk of bleeding. I would say that risk is extremely small. like extremely
I
extremely
can pretty
small.
much guarantee the surgeon will have no idea.
That's just it. They won't, so they'll tell you not to take it.
Yeah. So they're
yeah.
just going to say no.
Yeah.
And then how long do you take these after surgery? So, some of these things are expensive. The Apex Glutathione is very expensive. Like what, 4 weeks, 6 weeks? What are you thinking?
So with all of these, the amounts that they come in from the company that I've recommended, I would take them all until they are gone. For the B vitamins, that's actually going to be for, there's a lot in there. I mean, that's going to last you like almost 2 months after surgery.
Okay.
The liposomal vitamin C, if you're doing it twice a day, is going to last you about a week. Same thing with the liposomal curcumin is going to last you about a week. And then you can switch off to a tablet form of those. The rest I would just take until they're gone. So whatever is in the bottle, I would just take it until it's gone.
So like for vitamin C, we know that we've talked about this before in our wound healing episode that collagen's remodeling, even 6 months to a year. I mean, is it worthwhile to take vitamin C during that process? I guess at some point the remodeling thing is not using a lot of vitamin C after a while.
Well, it's that. And also at that point, you should be able then to get enough of what you need from your diet. As we talked about, like at some point, the supplementation should be, your diet should be able to pick up the residual. And I do talk about the book, the Perfect Health Diet, in our first episode. And it's a husband-wife team. And like that you can actually just, if you just Google the Perfect Health Diet, I think that's the name of their website. And it does have a little diagram of what's recommended. And that's what I would recommend. Honestly, they talk about getting a lot of organ meats, fish, healthy nuts and seeds. I mean, it really is an amazing kind of outline for what you should be eating before and after surgery. Now, if you're getting a lot of organ meats in, then maybe you don't need to take B vitamins at all or zinc, but most of us are not eating a lot of organs. So once your diet kind of picks back up to where it should be, and the supplements have run out. I mean, the zinc and the B vitamins, though, they're both big bottles. And that's why I like them, because they will last you well past the 6-week point, which is kind of when that like very acute recovery is over.
Okay, 6 weeks.
Yeah. And then until they're gone. I mean, some of them
I
will
understand,
be a
but
little bit
6
longer.
weeks is what we're looking at. I think this is so interesting.
You said you had 2 questions. What was the other one?
No, that was it.
Oh, okay.
Yeah. I think this is so interesting. There's not a lot of information on this because it's so fragmented. Mm-hmm. It's proprietary. Everyone's trying to sell you something, and it's hard to get definitive data because you'll go to a website and they'll be selling one product and they'll tell you just take
their
this.
product.
Yeah, their product. And there's not a lot of voices in this kind of supplement world that make sense, that are coherent and actually directed toward recovery from surgery. So by and large, I mean, this episode could be very helpful for people.
Yeah. One other thing I did not put on the slide about the homeopathic phosphorus is it's actually really good for recovery from dental procedures. It can help with excess bleeding, specifically from dental procedures. So if you're having any type of dental thing coming up, taking phosphorus right around that time might be really beneficial too.
Right.
Homeopathic is pretty awesome.
I'm still reeling from the fact that I didn't get these supplements when I had my surgery.
Some of them didn't even exist. Like the liposomal C, the liposomal curcumin, those were not around when you had surgery.
Didn't have any of it. I was just left out there like in the tundra.
I know. It's amazing you lived.
With lack of clothing. It was kind of inclement weather out there.
Also didn't bring your
While
walk.
you sat in this warm office with all your supplements, I sat out there with nothing.
I drove you to surgery.
That's a good point.
Yeah. Yep, I did. I drove you to surgery where I dropped you off with your book and nothing else.
Nothing else.
Yeah. Not even your wallet.
Not my wallet.
Yep.
And I walked in and the people were looking at me. They didn't know who I was. I mean, they found out, unfortunately.
Yes, because of a surgical tech.
Yeah, who ratted me out. They're like, "Oh, you're Dr. Martin. Oh, interesting." Uh-huh. But I forgot my wallet to the surgery. They're like, "Okay, man,
we're just going to believe you are who you say you are." Like, sure, you look like that's you.
Pretty sure people just don't want to walk in and do surgery that they weren't scheduled for. But this is a little bit uncomfortable.
Well, do you have a hernia? Like, might as well do surgery on it. Let's see. All right. So thank you all for listening to this podcast. Really appreciate it. If you have made it this far, I really do hope that you found this information helpful. I would love it if you would leave me a voicemail. 303-630-9038. Also, leave us a rating review. Share us with your friends if you know someone's having surgery,
Subscribe.
even not cosmetic surgery, any surgery. These are not specific to cosmetic surgery for supplements. So
because again, your body doesn't know if you're getting a tummy tuck or a hernia repair or got hit by a samurai sword.
That's
so
right.
we've established this.
Or getting a new knee. So really appreciate you all being here, and we will see you next time.
See you later.